and ready to go when you and Kara and Clarissa are ready to go.
I'm ready.
Right.
Yeah.
Okay, let's do this thing.
Indeed.
So good afternoon, state teams and partners who've joined us today. We very much appreciate your time in being with us. We are looking forward to an hour and a half of conversation and discussion and information sharing, primarily focused on family engagement strategies and the importance of family engagement. Our webinar today has been developed and will be led by our colleagues at Family Voices, specifically Kara Coleman and Clarissa Hoover, with very able assistance by Bethlyn Houlihan of the Boston University CoIIN leadership team. We've very much all of the work that they have put into putting together the webinar today. We're going to go ahead and start with just some quick housekeeping updates. We want to remind you today, excuse me, that this webinar is being recorded. So as we were discussing earlier, we want to make sure that anything that you wouldn't want to share with the whole wide world, you probably will not want to say on today's webinar. I'm going to try to restrain myself from saying anything negative about the New York Yankees, the Red Sox. That's just an example. We do want to remind you too that this webinar, as it's being recorded, it will be posted probably as of tomorrow on our newly launched CoIIN public-facing website. It just opened today. We're very excited. It is literally hot off the press. You can see that the web link here is available to you. If you want to go onto that and explore it at your leisure. There's not a huge amount of information on it yet because we're still developing the materials as our state teams are developing their projects. But we do want to say thank you very sincerely for reviewing the state team information that we currently have up on the state team project site. If you see anything that you want edited or changed, please feel free to shoot me an email anytime. They actually taught me how to make edits myself on the website, so I'm pretty excited about that new technological knowledge that I have. Please don't hesitate to let us know if you need any changes made to that, and thanks again for your time. There will be a shared workspace available to all of us with a portal to it through the CoIIN website within the next month or so. We're still in the midst of debating which platform to use, whether we're going to use Google Drive or whether we're going to use Box or Dropbox or Basecamp. There's a little bit of negotiation going on right now amongst our team, but we will make that decision relatively soon, and we will have that shared workspace ready for you all to start using. On the shared workspace, there will be things like a repository for the briefing books for our in-person state team meetings. You know, those are huge files, and sometimes folks have difficulty getting them on their state or through their state or institutional systems because there's just such big files. So those will live there, and instead of getting an email that bounces back to me with those attachments, in the future you will get a web link and be able to get access to them directly yourself. Also, we're going to have a library of academic and other resources from the world of children with medical complexity for you to reference at your leisure and in your project development, if that would be helpful to you. Each of you will also have your own state team folder where you can place documents for us to see, place documents to share with other state teams, place documents to share with other members of your team if they're not in your institution, sort of like having a virtual shared drive to have access to. So that will be coming within the next month or so, and we will be asking you for information to help populate that. The Boston University IRB application is still moving through its process. I know lots of folks have questions about IRB. We are preparing to answer those questions just as soon as we possibly can, and we thank you for your patience. If you have any other questions at any time over the course of today's webinar, please don't hesitate to type it into the chat box. I will, in addition to moving the slides along as Kara and Clarissa and Bethlyn are talking, I'll also be monitoring the chat box. So please go ahead and type yourself in there if you have any questions or need any help. that is pretty much it for housekeeping. We'd like to move now to state team updates. Ordinarily, we like to hear from you about where you're at in terms of your state team's progress, but we thought today it might be fun and a little different because we've been getting your state team status updates once a month, and we very much appreciate them. They've been enormously helpful to both us, to our colleagues at HRSA, and also to your state team coaches and seeing where you're at and where your technical assistance needs might be. Instead of concentrating on sort of the details of what you've been up to and what you've been doing, we thought today we would focus our time more specifically on what you think your biggest success has been since the last time we met, which was in May. We know you haven't had an opportunity to come to consensus on this, so as I call your individual state team, please feel free to jump in and tell us from your perspective, what has been your biggest success since the May webinar? And not to pick on them because they're alphabetically first, but I'm going to pick on them because they're alphabetically first. I'm going to open up the floor to Alabama first.
And I wanted to let everybody know I've been muting some of your lines for background noise because we have so many people on the call. So you should have the power to unmute if you're on by computer, or *6 to unmute if you're on by phone. Sorry, please go ahead.
If our team from Alabama is unmuted, please go ahead. Okay, I'm going to assume we're having a little technical difficulty, so let's go ahead and move on to our friend in Colorado.
Okay, here I am. This is Vicki, and I'm speaking for Team Alabama. Yay! But
Alabama.
I think we actually have a lot of successes. To me, terminology, learning terminology has been big, but speaking of PDSAs and QIs, you just name it. But some of our biggest successes, I think, we are rocking and rolling now. We have our definition finally resolved because that did take us quite a while. And so we've adopted our definition, part of it from Seattle. And so with that being said, we were able to request for data to look at numbers for our children with CMC from ages 1 through 21 with that definition. And so I am anticipating getting those numbers in, and we're going to move from there. We've just established 2 subcommittees, so to speak, from our team to core teams to work on a shared plan of care and care coordination so that we can start researching and looking for material and what's already out there, so perhaps we don't have to reinvent the wheel. So I may be calling on some of you guys to help us out if you are farther along in that regard. So anything else? We've done our first PDSA cycle, and we tested knowledge of parents on what they know about a plan, a shared plan of care. So we are really excited about that. We got results in. We had 21 surveys from that, and overwhelmingly, parents reported not knowing what that is. So we're happy to look at our numbers. It's no surprise, but we're just excited that we got that going. So, all right, that's it for us right now.
Thank you, Team Alabama. And I see from the chat box you signed in as a team. I think you have pretty much everybody in the state there on today's webinar. I'm really excited.
Yeah, Alabama, we rock. So I'm proud of us. So we definitely have to get us some core groups. So yeah.
Way to represent in Alabama. Way to represent.
Thank you very much. Let's turn now to Team Colorado.
And again, that's *6 to unmute if you're on the phone.
Sorry, can you hear me now?
Yay, there you go.
Okay. Sorry,
Perfect.
I was talking away, so let me try to remember what I just said. This is Denny from Colorado. And I think we have a couple successes that we could share. One is that we now have a complete core team, we had a project manager that still needed to be hired. So we just had our first meeting with everyone there, which was very robust discussion. And so we're happy about that. And then I think we've made some progress with our alternative payment model discussion. We were a little stuck on how best to approach that because our state's going through so many changes right now with our Medicaid structure. So we made some progress on that. And then I think we found two really good qualified facilitators for our advisory group that includes parents and providers. So that's progress as well.
That's fantastic. And the newly hired project manager that you referenced, is that Ellen?
Yes, and
Great.
she's on.
Welcome to Team Colorado and welcome to the CMC CoIIN, Ellen.
Thank you.
So thank you very much, Team Colorado. That was a great update. Let's turn now to our friends in Indiana.
Hi, this is Mary Ciccarelli. Can you hear me?
Hi, Mary.
I think our best progress to date has been our meetings with our state Office of Medicaid, as well as we just had a meeting with our 4 different managed care entities and working towards an alternative payment model that I think actually may go live. Hugely necessary for us to be able to fund the project. So we feel really, really pumped by this.
That is music to my Medicaid loving heart.
Mm-hmm.
That's really exciting. I think as a preview of coming attractions, we're very excited during our in-person state team meeting to try to have examples from the states who have had success in both thinking about alternative payment methods, but also in engaging with their Medicaid program to help their colleagues think about similar strategies that they could potentially use in their state. So I will be reaching out to you, Indiana. Thank you very much. I'm going to turn now to our friends in Kentucky.
Hi, this is Judy in Kentucky. Can you hear me?
Yes, thank you.
Oh, great. Well, we've been having some exciting times here. We've had major changes in our state health cabinet. So we've had new leadership for Medicaid, for Department of Community-Based Services, for Public Health, and the Secretary of the Cabinet. All of those people are new within the last month or so. So that's big changes. But we're working with them. We're continuing to work with them. We've had good meetings with the Office of Inspector General talking about new ways to provide services for children on home ventilators. And that's going well. Talking about certificates of needs and maybe getting rid of that requirement for public or for private duty nursing. And so that's probably the biggest thing that's happened in the last month.
That's really exciting. It sounds like you've made some good progress in the midst of a lot of change in which
Yes.
Really anybody from the Commonwealth of Massachusetts with us today?
This is Lori. I think there are a bunch of us on the phone, but we're not together. Is there someone, can you hear me?
Yes, Lori, I can hear you. Thank you.
Perfect. Is there anyone else on the team that would like to give an update? All right. Well, I guess I will do that. I just didn't want to jump in. So we have had a pretty exciting, what's it been, about 6 weeks. We've continued to flesh out our team. I don't know if Elizabeth was on board last time we all met, but she is a research assistant who's really just helped to provide wonderful structure for us. We've been looking at data regarding the most common surgeries among children with medical complexity and sort of developing a list of those which are done most commonly to try to further refine the focus of our project. I think that the most exciting thing that we did is very recently we gathered all of our stakeholders and we had a wonderful, rich conversation that was around a driver diagram, the development of a driver diagram, so that you know, we have this sense that the experience of going through surgery for children with medical complexity in their families is less than ideal, but as we go about creating ideas for change and enhancing that system, we wanted to make sure that we are really informed by a variety of stakeholders to develop the best interventions, and that was just a fantastic conversation. So I think that we're continuing to refine, we're looking at the data and anticipating next steps of digging deeper and probably conducting some interviews. So yeah.
That sounds great. Thank you.
Mm-hmm.
I'm going to turn now to Minnesota. I think I see Sarah Cox signed in.
Yeah, can you hear me?
Yes, Sarah, thank you.
Okay. Honestly, I would say probably the biggest success we've had since the May webinar was getting our cover road in place. So that
Can we get you to speak a little louder? You started louder and then got quieter.
okay. I'm on my computer audio, so I would so I would say the biggest success we've had has been getting our sub-award in place, honestly. That was kind of a bit of a process for us. And that means that we will be able to reimburse our family advisors for the time that they've spent on the project so far. So that is probably what I would say right now is the biggest one right now.
Sarah, I can attest that that is a huge success. and as they say, no money, no mission. So well done. That's a big deal. Thank you. I'm going to turn now to Oregon. I think we have Allison on the line with us today.
We do.
Yeah, can you all hear me?
Yes, very well, thank you.
Great. So I think that there's three kind of wins that I'm most excited about since May. First of all, we have 3 family representatives on our advisory team, and 2 of them are external to OHSU. And one of them, all of them participate on our family input work group, which is essential to our environmental scan work. And one of our external family representatives gave an update on that work group's work to our advisory team. And I'm really pleased, and she's on the call, and I'm really pleased and proud for her because I think it's great that everyone gets used to strong family voices in our advisory team. We also have a process in place with our advisory team for taking our environmental scan results, incorporating them into a fishbone diagram to then implement or develop and then ultimately implement our quality improvement project. And so I'm real excited about that. And then also our environmental scan work needed to go through our IRB, and something that I haven't had to work through before is having external investigators participate in an IRB process. And so our family representatives are going to be conducting the interviews rather than assessment and evaluation staff. And we're all very excited about that, but there's been some layers of bureaucracy involved in that, and I'm hopeful that we're nearing the end of that. So that's the update from Oregon.
Thank you, Allison. That's great. I think those were wonderful examples that cue us up nicely for the conversation that we're going to have today on this webinar. I also just want to point out in reference to both Oregon and Minnesota's comments, let's not underestimate victory over bureaucracy. That's a huge success.
Yeah.
So yay. I'm going to turn now to Texas.
We've got Rahel and Marianne are sitting here together, and I would say we have kind of two wins, starting with our parent group. We have parent representative Carrie from Texas Parent to Parent working with our family liaison, and they've already gotten a group of parents together that are interested in participating. They just had their second meeting, and we're bringing to them some of the questions that have come from the measurement workers about quality of life and what does quality of life mean to them, and how would they describe unmet needs. And so we've got a very active family group. And then our second one, I have to say, would be our stakeholders.
So this is Rahel, and we've had an amazing engagement of our core stakeholders. At this coming back from Seattle, we had every other week meeting of at least 90 minutes and all the stakeholders.
Marianne, can you speak up a little? It's a little hard to hear you. Sorry to interrupt.
That's all right. Go ahead.
So we've had participation from all core stakeholders every other week, including the two medical directors from the two MCOs, a policy representative from HHSC, Michelle CoIIN, and our representatives from Title V have attended. There's been near perfect attendance of all the sessions that we worked through pretty diligently on root causes and key driver diagrams, refined our aims, and are approaching, we have agreement in principle with the MCOs about what the value-based payment structure will look like and what things in addition to payment need to be changed, including delegation of service coordination and streamlining the prior authorization process, etc. And we hope to have that completed before the end of the summer. So we've made quite a bit of progress.
That's wonderful. Thank you so much. I just made myself a note that Texas is another state to follow up with regard to in-person state team meeting and alternative payment methods. So thank you for that. We're going to turn the floor over now to our friends in Washington. I think we have Jill and Paula on the line today. Jill and Paula, if you're speaking, I think you still might be on mute.
Okay. Hi, it's Paula. Jill was going to speak for us, but she lost her audio ability to mute and unmute. So I'm now speaking.
There we got it.
Oh, maybe she got it. Are you there?
Thank you.
No. No. She thinks she's talking to you, but she's not. Okay. So I'll give our update, and if she comes on, she'll take over for me. So since May, I think the biggest thing we did, yes, we've been doing the bureaucracy hurdle as we had to move our award from the hospital side to research, but we're almost finished with that. But more importantly, we just completed a PDSA cycle for our charter. And y'all can laugh because, you know, we're on version 7 of our aims and charter, but we really feel this is foundational to our work, is to really hone in and get very concrete about what we're trying to do and then to validate it. So we actually did a chart review of 30 potential patients that we would put into our cohort. And in that process, discovered that, if you recall, we had narrowed our focus a little bit to a nutrition focus. We were going to focus on kids graduating from the NICU with a feeding tube. And we've really expanded that to say any child with a chronic disease and or a functional disability who gets discharged from a hospital setting with a new diagnosis under the age of 1 is going to be in our cohort. And this is very exciting to us because we got validation from our NDV and birth to 3 peers that they rarely get referrals for kids that are less than 1 year old. So we know that we don't identify these children very well and very early, and therefore we missed out on a lot of potential resource allocation, as well as assuring that they get into the appropriate services. So we've got some validation on that, and we are just this week and next week going to do 5 to 6 parents interviews to validate this new sort of expected scope. You want to know, Joe? No. It's still not working. No, it's still not working. And then the second thing we're doing, is looking to bringing in our family engagement, Part C family engagement, which are our family resource coordinators, if I'm correct, in our neurodevelopmental birth to 3 centers and to our leadership team. So now that we've expanded our focus to say that part of our work is to really assure these kids get connected, we're going to bring them on the leadership team. So that's what excites us right now.
That sounds great. Wonderful. Thank you. Last but not least, our friends with Team Wisconsin.
Hi, this is Sharon Fleischfresser. Can you hear me?
Hi, Sharon.
Hi, and joining me is Tara and Mary Ellenbach, and there might be others, I don't know everybody's phone number, who are on, so I'm going to ask them to jump in if I miss something. A couple things. Last week, our teams from both the University of Wisconsin American Family Children's Hospital and Children's Hospital of Wisconsin had a retreat that Tara and the folks organized, and it brought together family representatives from both of the teams, along with
Did we lose you, Sharon?
Let's see.
Can you hear me again? I might have muted myself here.
Yeah,
am I back on?
She's there. You're there.
Sorry, I don't know where I left off, but we had a retreat that included family members and social workers and nurses and folks from our Title V Regional Center met last week and really focused on an area that of the connection between our special needs program at the two at UW and at Children's in Milwaukee, and the connection to our Children's Waiver program. We had asked our Children's Waivers program to create a linked file of those kids who were enrolled in both programs, and found that the number of kids were much less than we thought. And so starting to do kind of mapping referral processes and further work to better understand if they're, number one, getting referred, and if they are getting referred, are they being found eligible in that process. So that was really very exciting. In addition, the teams from both American Family and Children's have sent out their survey to families related to the shared plan of care that will serve as baseline information. And then, since folks have been talking about payment, I think we mentioned this at our face-to-face, but Wisconsin began paying Medicaid for care coordination since retroactive to September of 2017, but I think started receiving payment in March. And Tara and Mary, you tell me if that's a lie.
After she's done.
No, that's pretty true.
All right. Anything else, guys, from Wisconsin?
Nope, I think that covers it.
All right.
I agree. Thanks, Sharon.
That's great. Well, thank you, Sharon, and thank you all teams. We did not ask you to do any thinking ahead of our asking you about your biggest success. We really wanted it to be sort of spontaneous today, and you wouldn't have known that with the depth and the breadth and the thoughtfulness that went into the responses that we just had. So thank you all very, very much. We appreciate that. It sounds like people are making great progress. It sounds like there are a lot of interesting things happening amongst the state team, and especially it sounds like there's a lot of things that are happening amongst the state teams that could potentially be helpful to your colleagues and your peers. So we're going to look forward to taking some of that and moving forward with it and being able to be supportive to you all as we do that. Before we move on, before I turn the floor over to Kara, I just want to say one quick thing. So today's webinar is set up not just as a presentation, but also as a discussion. And so we're very much looking forward to you all sharing your thoughts, sharing your perspectives, sharing your impressions with us. I did mention in the beginning of today's webinar that the session is being recorded and it will be posted to our public website. But I do want to encourage you in that context to please be candid in your conversation today. This is not necessarily an easy topic. There are lots of different perspectives, lots of different levels of experience that we all have with regard to family engagement. As Kara pointed out in a phone call earlier this morning, we are a CoIIN, so we are collaborative, and we are all about improvement, and we are all about innovation. And in order to do all of that, we have to be able to have good, honest, clear conversation with one another. And so I'm very much looking forward to learning from Kara and Clarissa today. I'm also very much looking forward to learning from you all. And that said, I'm going to turn the floor over now to Kara. And Kara, when you're ready for me to change the slide, just let me know, okay?
Okay, actually, if on that first slide, if you could click in so we can start with that YouTube video, please.
You got it.
Oh, please work.
Meg, if it's playing, I can't see it. I'm still looking at the slideshow.
Is it playing on your screen, Meg?
Let me just put on pause for 1 second and see if I can back it up, start again, and get it onto everybody's screen. I apologize for that, guys.
Thanks for your patience, everyone, as we get to these technical difficulties. This is worth it.
Can you see the Cowboys?
Yeah, we can see the Cowboys.
All right, here we go.
Here's my great grandfather. He was the first Cowboy in our family. If you look at history, it's just script, you know. You see the movie, you see the story. Not everyone can do it, but when you bring it to the camera, one of them,
Yeah, sorry guys. As you know, I've only spoken to you one other time and I like to draw analogies and stuff. And so we were trying to use this video. I apologize that the audio didn't come through. I hope you saw some of the images, but I was able to earlier in June to have a family vacation at a dude ranch in Wyoming. So I very much have cowboys, wranglers, horseback riding in my mind. But then I came across this video of herding cats. And I thought that that would be kind of a funny place for us to start to get everybody sort of in the mood of talking about family engagement, professional engagement, how do we work together, team engagement, partnership. Because I don't know if everybody's had that experience of different teams, partnerships, and other things, but it's often like herding cats, and working together within a family, within a multidisciplinary team, can often feel like herding cats. It's all kinds of people, experiences, lenses, perspectives, professions, cultures, et cetera, you name it. There's, differences. And it can feel at times like herding cats. One part of the video, I think Meg just said that she'll send it around so you guys can see it better, but these lovely cowboy and cowgirl cat herders talk about the wonderful experience they have at the end when they come to the end and they keep their eyes on the prize and they're going across the deserts, across rivers, dodging tumbleweed, that they all come together at the end, and they say that there's really nothing else they'd rather be doing. And I think that that's a lot of what all of us on the CoIIN feel, that regardless of the ups and downs and how we get through this, there's nothing else that we'd rather be doing to try to advance the care for kids with medical complexity. So as you see here, we've got the objectives and the outline in front of you, but just sort of going through these, what we hope to do today is kind of get on the same page and have a shared understanding of what we mean within our CoIIN by family engagement. And just, we also want to begin to answer some of the questions. Thank you guys for doing the Survey Monkey work and kind of working through some of the questions or creating other questions that you've always had about family engagement. What are some of the barriers? What are things that you want to do? What are new opportunities and things that you can create around family engagement? And our time is unfortunately limited today, or fortunately, in this webinar. So we're not going to probably be able to work through and grapple through all of those questions and every issue around family engagement. And it's a process. But I think that we're at a great start, and we have 4 years together to do this. And I think, as we'll see when we talk through some of the questions, there's really quite a variety of responses and sort of priorities for questions that each of the state teams put forward. So that kind of tells us that maybe we're at a point where we should tailor some of the discussions and the work and the crafting that needs to come around with family engagement. And so Meg and Bethlyn will talk later too about some of the new and sort of different and creative ways that we can come up with to work together, to advance family engagement. And just as Meg said that we were talking about earlier, that the CoIIN model is really grounded in collaboration. That's the approach. And not just within, your own state, but between other states as well. We've just had our second family leader call. And on the first one, that was the thing that really struck me, was each of the family leaders from the states coming together and asking questions of each other and learning, and then being able to take that back to their own state. So one thing we want to hope to generate from today is just more connections. I appreciate everyone and their successes that shared about where they are with some of their family engagement things. It gives ideas to others, and people can connect. And it's really critical, I think, in the beginning stages of this QI project. So next slide, please. We thought we'd start off with a little bit more of the us talking to you, Clarissa and I sort of going through, making sure that we're on the same page, and having a shared understanding with family engagement. Of course, use that chat box if you want to ask questions along the way or interrupt or whatever. But we thought we'd take like 15 minutes to kind of run through the definition stuff, the frameworks, and then we'll move on to much more of the discussion and everything else. So how do we get on the same page? In healthcare today, we have so many buzzwords in healthcare, in life, and social media, and everything. And what exactly is family engagement? Unfortunately, it probably means different things to different people. How do you do it? Do you want to do it? As CoIIN teams, you guys all signed up for it as part of you joining the CoIIN. You volunteered to be a part of the CoIIN. You volunteered and really want to robustly engage families. you know, especially with 2 of the 3 goals that we have on this CoIIN focused on the well-being and quality of life of families and their children with medical complexity. You know, in this CoIIN too, we have 10 state teams, 10 varied experiences within, you know, amongst states, within state teams with family engagement. There's a big spectrum, and no matter where you fall on that spectrum with your experience, and your amount of time engaging families, or, you know, wherever you are on that spectrum. We tried to set up today a little bit in a way that will inform, but then also draw out and draw upon the experiences of others that can help teach us and help us collaborate. And just ask that you're open today to looking at other lenses, maybe looking at how you've engaged families and new ways that you can do it, and searching for other creativities and solutions and stuff. There's a tremendously long and powerful history of families bringing about change in healthcare, and not just for their individual child, but at a systems level, which is what we're really talking about on this CoIIN and family engagement. 25 years ago, Family Voices was formed by leveraging the lived experience of families to create home healthcare workforce, to bring their kids home, to advocate for real policy changes, to create waivers, and so much more. And today that work continues. But sometimes it's becoming stymied either by misunderstanding of family abilities and roles, misunderstanding of varied professionals and their roles or provider roles. And there's maybe inexperience or different experience, and that's whole, you know, herding cats thing. How do we look through other lenses? How do we get such a variety of cats all moving in one direction? Maybe there's not been the opportunity. That's the beauty of this CoIIN, is opportunity. Maybe there's lack of evidence, so we can't engage because there's not the evidence we need. But all these things are things that we have the opportunity on this CoIIN to change. So to get us on the same page, we thought we'd be helpful, you know, it'd be helpful for us to take a step back and work through the formal definition, and then move on from there. So Meg, if you could move on to that next slide, please. So, all right, just because the herding cats analogy didn't work, I thought I'd move into that word. As a lawyer, I can't remember if I said this in the in-person meeting, but as a lawyer, I find that I often fixate on words a lot. And, you know, whether there's an and in the right place, or what does the word actually mean, and what do people think it means. And so that word engagement, for some people, it kind of, you know, for some families and maybe for some providers and professionals, it rubs us the wrong way. Like, what does that mean? So when I think of engagement, many of us do, we think of these images here on the screen. Well, yeah, the images on the screen here. So one of the images here is that big fat diamond in the middle, and the other one being put on a finger, right? Put a ring on it. Even Beyonce, doesn't she sing about that? Put a ring on it. And I just wanted to draw the analogy of, you know, is it the same? Here we're talking about partners joining together in some sort of holy matrimony or a lifetime of partnership together. Is that the same as what we're doing on this CoIIN? Is that the same what we're doing in family engagement and the healthcare system? I think it is. And the ring itself is kind of like our care system, the system of care for children with medical complexity. It's a continuum. It's often very personal. The connections, it's continuous, it's ongoing, it's circular, it's never ending. And by putting a ring on it, we're making it official. And putting a ring on it with family engagement and making families more informed and engaged in the system of care, we're treating families with respect. We're viewing them as equal. We're valuing that lived experience that has for the past 3 decades really brought about a lot of change in the healthcare system. We're making them members of a team. We're compensating them. We're valuing them. This is really all sort of coming together as the definition of family-centered care. So, you know, engaging families and being engaged in family engagement is really, you know, the core of family-centered care. If you look at the images where the woman has her hand up saying, I said yes. I sort of took that image and did the analogy of he asked and I said yes, the team asked and the family answered. If you ask families to help, to contribute, to collaborate, we often say those same things that you do at whatever your altar is where you're joining in some sort of partnership, we do. And even if the care of our kids maybe becomes too much at times, too overwhelming, kids are in the hospital, things are going on. If you're partnering with many of us, the more the better, and the more diverse the better. And if you're partnering with a family-led organization, there's multiple layers of engagement and support. Just like in, matrimony, you're joining families together. Very literally here you are, if you're partnering with a family in a family-led org, you're joining and partnering with multiple layers of families. And the last sort of analogy I wanted to draw is a sort of more intimate one on the right with the two souls coming together, the sort of romantic part that, healthcare teams and systems of care for children with medical complexity, it's very intimate and can be sort of romantic in a sense. When the team works together, it's very much like many souls or many cats, right? Beating as one. You're coming together, individuals, and sort of losing your individuality and coming together as a system and providing care in a very intimate way, much like, joining with your life partner. And the reality of this word engagement, and I think where the tricky part comes in with the word engagement is that parents and families actually don't need to be engaged. They are engaged by nature of having children who are patients, and they're not the patients. What you need to engage them in is the systems level change. So with that, let's scoot on to the next slide, please. So here is a shared definition that we can work off of family engagement: an authentic partnership between professionals and family leaders who reflect diversity of the communities they represent, working together at the systems level. And the three words that I think we should highlight and focus on are authentic, that it's real and meaningful and not token. Don't fall victim to checklisting of family engagement or being in another silo, that we want to figure out creatively in this CoIIN how to innovate, how to take provider, professional experience, lived family experience, and bring it all together authentically for change. Partnership, it's the same, the analogies I just drew with equality and respect. And then systems. I think quite a few of the questions that we're receiving and the prioritization of questions centered around some of them, the experiences of when you bring families in as individuals for change, and then when we're looking at individual changes for the care of one child with medical complexity. And when we're talking about family engagement in this CoIIN, what we really want to be focusing on is bringing families in to bring about change in systems of care. And that's a real critical distinction, and one in which families and professionals alike need training and support and onboarding of how to work together in this professional systems level arena for change. And no matter what it looks like, family-centered care is at the core of it. Next slide, please. Last slide on my little part here. I love this picture, and I think we could probably, one more minute. Okay, Bethlyn's prompting me. As I was about to say, I think we could dwell on it. I personally could look at it and come up with a lot of analogies from it all day of what it depicts in the care of the state of the healthcare system for our children with medical complexity, the story of it. And really what we want to focus on is the positive and draw out why we all joined this CoIIN and why we're here. The systems change is hard. Engaging all the right partners, not just bringing them to the table, but drawing from everyone their skills and their contributions authentically, and putting everyone in place is really complex. But if we go back to, the Cowboys, where I said that they were saying there isn't anywhere else any of us herders would rather be, I think that we all agree that we're at a point in the care of children with medical complexity where, for any myriad of reasons, we as a whole are no longer willing to be funneled or pushed or siloed to the simple but wrong solutions or answers, that we really want to delve into what are the complex choices? I mean, we all know they're complex. What are the right choices? Regardless of how complex they are, we want to go down the right path. And how do we do that? And maybe you've been engaging with families, for the past 20 years, and you've been doing so really well. This CoIIN is an opportunity to come up with really new and creative ways to bring about change. And think about outside of the CoIIN in the future and the larger, 30,000 view in 4 years, where are we with family engagement? There's a lot of really great things that can come of it. So with that, I will hand over. I think we're passing to the next slide and handing over to Clarissa, please.
So hello, everybody. I guess I need to put my face up there too. Hello. My name's Clarissa. I'm with Family Voices. I see a lot of names I recognize out there, so I've definitely met some of you before. But I am here today to talk to you about some work that Family Voices has been doing on trying to pin down family engagement in systems a little bit and trying to understand what makes it good, what makes it work. This is a project that we've been doing for a while now this isn't really what I'm here to talk about, but we've done the work and we're hoping that this is something that's going to be useful. That we're recognizing 4 domains that kind of identify the key activities and key qualities of successful family engagement, which are representation, transparency, impact, and commitment. And I'm just going to take a few minutes to kind of talk about those a little bit. A lot of times when we were going out and looking into this, we were finding really long lists of all the different things you can do for engagement, and it was kind of hard to figure out what should be done first or what the priorities or goals were. And so we think that it's helpful to organize it into these kind of domains to figure out where we need to be focusing and what well-rounded engagement looks like. So the first piece is representation. We know that that's incredibly important. We know that it can be difficult, that sometimes the families who show up for engagement are the ones who have the easiest time dealing with professionals to begin with, and they're not really representing the people who aren't having their needs met as well by the system. And so in terms of ensuring a diversity that reflects the community that you're serving, just a few, one thing is just have to do it. Be persistent and keep on reaching out to people and reach out in a lot of different ways. So it's key to understand what your priority communities are, who you want to see at the table, who isn't currently at the table, or maybe there's one person at the table kind of struggling to explain and they're in a tough position, because tokenism is always a hard position to be in. Targeted outreach, such as working with community-based organizations who are already focused in the communities that you need to connect with. Going where people are, such as health fairs or churches or beauty parlors, and talking to them there and making connections there, and recognizing development that's already going on, such as training programs or advocacy programs, where you can meet people who are already starting to find their footing with this family piece. Wow, I have a very short time and this is very quickly. So I'm going to move on to transparency, which has to do with letting families understand what's going on, being transparent about information, sometimes talking about things that seem a little bit delicate, like internal conflicts or internal politics, and partnering at all stages from the very beginning. Sometimes that's a matter of doing what you can do rather than what you want to do. Again, what I was saying before about going out to health fairs or beauty parlors, if you don't have the perfect partner who can come to all of those meetings and interact with the professional partners as a peer, sometimes that starts with talking to people just more fully, and they can kind of help you understand what's making that hard, help you understand what resources people need in order to connect with that. The third piece is impact, which sometimes we get the feedback that this is a little circular. We're saying you have to have impact in order to have impact. This is one of the things that's really kind of distinctive about family engagement. And it comes down to the fact that as family leaders, we've got a lot of demands on our time. Our children have really powerful needs that we need to respond to, we have to know that this is worth it. We have to know that it's going to make a difference for our kids and for everybody else's kids that we care about. So in order to demonstrate that, and this goes back to what Kara was saying about it being meaningful, we have to make a difference in order to put in the time and know that it's worth it for us to put in our time. So it's important to set expectations where you know what family leaders are going to be contributing. Be open to things that are unexpected. So you have the things that you're expecting and then the things that you aren't expecting. It's all good. Sometimes there are going to be paradigm shifts that just come out of nowhere. And then also recognizing and acknowledging how family leaders have contributed to the process. So you know what a difference it's made, and they know that you know, or we know that you know. And then the last one, sorry guys, I'm going to make this quick, is commitment. This is where it really all comes together, is that family engagement is institutionalized. It's occurring in a lot of different activities in a lot of different ways. When you're hiring new staff, particularly new leadership, you ask them during the interview if they have a commitment to family engagement or if they're going to dismantle everything you've done. Sorry, I'm short of time. I'm sure I could have come up with a better way to say that, but a lot of us have already been there, and so kind of know what that looks like. And including when you're writing budgets, anytime you're writing any kind of a budget, look for the opportunities to write family engagement in. Keep a wish list of items that you want, such as being able to pay stipends, such as being able to have a staff member who really makes the family leaders their priority and acts as a liaison. And then look for those opportunities to budget that in, either to your annual budgets or special proposals you're writing, or just, anytime money is being allocated, you need to be thinking about how it can move this forward. So that's the very quick overview to how we are trying to break this up and think about it in a move ahead kind of way.
Great. Thank you, Clarissa. Okay, next slide. I think we are on for our aha moments, if hopefully this video works. If not, we can go into aha moments as is.
Have the phrase in the dictionary. I would really have a phrase in the dictionary named after your phrase, aha moment. That's crazy. You know what the wonderful thing about aha though is, I can't even remember how early on during the show days I started saying it, but this is the thing about an aha moment, and I love having them where you think you've never thought of it that way before. Right. But an aha really is, think about this, you can't have an aha unless you already knew it. So the aha is a remembering of what you already knew, articulated in a way to resonate with your own truth. So the aha isn't somebody teaching you something. The aha is somebody helping you to remember. That's an aha moment for me. I didn't think about that. That's what it is.
So I'm not sure if everybody had the chance to watch that before, and that was an aha for me watching that video about ahas. I didn't realize that it was something that you sort of already knew. But whether your ahas or some of your best ahas around family engagement are things you knew in the past or just found out, Beth Lynn, my hero with Zoom, is going to slip us all into breakouts where we can spend the next, what do you think, 10, 12 minutes, Beth Lynn, sharing aha moments with each other. The goal is, as we said, to have them be around family engagement of any kind, but ahas are ahas, and they move us all forward and inspire us and remind us why we're doing this work in the CoIIN that we are. So when we come out of that, maybe if one or two would want to share an aha moment, that's great. And then we'll go into talking through and beginning to walk through some of the questions that we've prioritized to use to talk about family engagement. So Beth Lynn, I will hand to you.
All right, thank you. So I think that I've broken out everyone that I've been able to identify into the rooms. There are some people that seem to be on the phone only. So what I'm going to do is I'm going to send everyone to their rooms, and then there may be a few more. You may know there are some that are on the phone only. I'm going to kind of roll call each of you and then assign you. And I do have one name and so I'm going to send everyone to the rooms first. we'll give you a warning when we're going to be closing the room. So Meg, if you could go to the next slide. There, okay, great. So we're going to have a chance for people to share any aha moment for you around family engagement, whether it is any time in your life experience and obviously it's a bonus if it happens to be around this particular project or something related, but in terms of family engagement and whether, and this is also even, obviously if you're a person from the family perspective, then you share from that perspective as far as your aha moments in the process. And then you can nominate a person, or everyone just have in mind that when we get back together as a group, we will ask a few people to share with the group because so that everyone gets a chance to hear some shared experiences along the way. So that's it. So if you could go to the next slide, Meg. I just want to make sure everyone sees some instructions. So I'm going to invite you to join your breakout room. It will have the initials for your state. You hit join. If you need help at any point, at the bottom of your taskbar is at the bottom of your screen. It says ask for help, and you can invite the host to come into your room and give you some assistance if you're having trouble. And otherwise, when it's time to come back into the breakout rooms, a warning will shoot up on the screen, and then you'll automatically be drawn back in. Okay? All right. I know you're all on mute, so I'm just going to assume you're okay. All right, and you let us know if you're having any trouble. All right, so I'm going to open the rooms now, and then whoever's left over, and we're going to work with you. Okay, so let me go see. Okay, so I have Debbie Gilbert. Are you going into a breakout room?
I can.
Where would you like to go?
Wherever you want me to go.
Oh, you're not in a state team?
Kentucky.
Yes.
Okay, great. And I'm going to put you with Kentucky. All right. Thank you.
Okay.
All right. Let's see if we can. Yeah. Okay, great. Now, I have a phone number, 503-601-4403.
Anna's Oregon.
Oregon?
Yep.
Great. Okay. I'm going to send you there now. I have 617-624-5000.
Hi, this is 617-624-5000.
Where would you like to go?
Massachusetts.
Great. Thank you.
Thank you.
Okay, I've got 617-930-4288.
I think that's all those Boston Red Sox fans, 617.
Yeah. Yeah, they're
Put
all
them in
jazzed
that
up.
Massachusetts room. All right, go team.
And then I think the last one that I have, and I don't know if she might be in the breakout already, is Paula.
I'm here. I'm not in the breakout. I'll join.
You aren't? Okay, great. So I'll put you in there right now, Paula.
Thank you.
All right, so everyone else here, I've got Anna Maria, Kara, Clarissa, Mary Webster, Meg, me who is impersonating Meg, and Sally. And I still have one other phone number that I don't know if they want me to assign it.
I'm listening. I'm just going to listen.
Very good. Okay.
That's on my
Great.
Gerald Zarin should be in Texas.
And I'm sorry?
I think Gerald Zarin should be in Texas.
He is, as far as he was in there.
Great.
But he's offline now.
All right. Well, so for those of us who are here, we are on the recording part.
Yes.
We are. We're
So we
recording.
can't share our aha moments while we're waiting and they're sharing.
I mean, you could, but then just be aware that everyone will hear them. That's not necessarily bad, right?
Yeah.
Okay, let me see. Okay.
I'll
Did you
share
have
mine
something you?
if anybody
Yeah.
wants to hear. Yeah, what the heck. Mine is not around, not necessarily around KOI, but I guess it is. It's sort of my start in shifting to be, you know, a family leader and shifting. How do I use my skills and as other professional, as mom, as whatever, and my ability to shift and influence change in healthcare, where I was trying to navigate and not understanding. So it was, you know, when I wrote that children's book about justice, I really focused and centered around people first language, because for me, when I heard Kathy Snow talk for the first time and described, you know, again, you know, the lawyer fixating on the words, but how it could completely, you know, freeze justice out from having any friends, you know, peers that viewed her as a human being versus not, depending on the language I used and how she was presented or not, or talked around and not, you know, to and with. You know, that writing that book, I wrote it for children and to try to help her, you know, make friends and open those things out in kids. But my ability to then switch and have it used with medical students and begin to get the feedback from them of how, you know, direct feedback of, well, then when I was seeing Miss Jones in my 4th year, I knew exactly how to speak to her, even though she was nonverbal, because you and Justice taught me, you know, you treat her as a person, you speak to her, you know, address her directly and all that. And so it really was an important point for me in life, you know, an aha to understand, oh, I do know how to function as a professional. It doesn't matter what letters are after my name. I can function in this healthcare arena and bring about change, and change that, you know, helps my daughter in the immediacy and so many other kids, and, you know, opens lenses and eyes and helps everyone work together and blah, blah, blah. I can go on. But for me, that was just, it was like a drug in a way, that to see the way that I could shift people's minds and change just by looking at words differently was unbelievable, and gave me confidence. So there you go. Aha.
I love that perspective, just because I think that you hear words have power, but to see that in action and that it's the way that they can shift perspectives and empower and disempower, it's definitely a very important piece to bring to the picture. So trying to shift paradigms.
Yeah.
When I was in training, I was technically a pediatric pulmonary center trainee, which is one of the programs that MCHB funds. And one of the things that we got to do was shadow a clinic, which was really crazy for me because it was my daughter's healthcare providers. She has cystic fibrosis, and it was an asthma clinic in another town. They actually, they take puddle jumpers to fly to different places in New Mexico, but I had to go to one of the closest places to drive because there wasn't any room for me on the plane. And, you know, just like having that experience for a day of, you know, seeing 12 patients and sitting down and talking to them, and about half of them, the appointments were in Spanish, and being in the break room with them, you know, was a really different perspective on the experience of what they do. And, you know, I'm not sure I can even really put it into words in terms of what the aha was. It just really, some things into context.
Mm-hmm. Mm-hmm.
And how was there a way that shifted how you approach things moving from there? Because it sounds like it put things in context and that meant something for you.
I guess it was sort of part of an overall pattern of seeing how things look different from a different angle.
Mm.
And I think it made it easier to talk to them.
Yeah.
You know, that when I was talking about stuff, it wasn't, you know, it had at least a little taste of what it looked like from their perspective.
Yeah.
Mm-hmm.
Good stuff.
Yeah.
That reminds me of an aha I had while I was teaching. For the past, 15 years or so, I've been part of a program that works with medical residents, specifically in the ICUs, around relational and communication skills development. So how to talk to patients and families more compassionately and humanistically in intensive care situations. And one of the ahas that I've had over the course of that time is when you hear the residents talk later about why they said what they said to a patient or a family, where when you heard it, you went, what in the world were you thinking? They usually have a really good reason for why they said what they said. It just came out wrong, or their intent wasn't clear, or the story behind what they were saying wasn't clear. And so the aha for me is that people don't purposefully come off badly. It's just clumsy delivery. And so helping folks figure out not only how to not be clumsy to begin with, but how to recover from when they are clumsy, because we're all human, we all are clumsy at one point or another. How to try to recover from that, how to try to show your good intent, how to try to show your compassion in a way that overcomes the maybe not so great words you chose. I think that for me has been a pretty big epiphany over the years when it comes to my kids' care, but also the work that I've done. People usually have a good reason for doing what they do. It's just not obvious.
Yeah, I love that. And I think for me, I've watched that some in my work with medical students and residents too, and that I try to teach, sure, there's all these ways you can teach them how to deliver news and other stuff, but you said we're all human. I mean, that's the bottom line in this, and that if you don't deliver it quite right, that's okay. If some good intent, some compassion, some sincerity, empathy, and that comes through, like if all else fails, if you have that in there somehow, that or able to see that it was there, maybe it was just a little awkward.
Mm-hmm.
Yeah, it makes us all be able to relate, like we are human, and don't you forget it.
But even that can be a real aha, right?
Oh, no doubt.
Like obvious, but yeah, in the crucible, especially of the intensive care unit, it can be really easy for that to get lost.
Easy, yeah.
Well, I would love to, I could really continue this discussion. I need to close the breakout room so we can go back and come into the main room. So it'll have 60 more seconds. I'm going to close the rooms now. And then everyone will be back, just so everyone knows. But, yeah. The thing that occurs to me as we're talking about it, one, I just see coming from the world of spinal cord injury, just with this kind of dynamic, the absolute parallels, and like the sense of the community just continuing of people with spinal cord injury continuing to feel like, why isn't this, why we keep trying, we keep advocating, and we had the independent living movement in the 60s, and here we are still trying to get all this to come to fruition and work within the system and be heard and be a part of it. So I hear that, and then I also hear my brother, who's a doctor, and I have people that were on our team that are clinicians that are like, this is just it's like an uphill battle all the time to try to work within the system to navigate and get what my patients need and to take care of this, do that, and I get tired, and there's a lot of different.
Yeah.
Now
we're mixed with another break.
Oh, great! I think everyone's coming back. So,
hey Meg, could you move to the next slide, please?
Just mute.
Thank you.
Welcome back, everybody.
Uh-oh.
Do we have any ambitious volunteers that were so moved by an aha moment or anything, one or two that just want to share?
Well, this is Michelle Irwin. I felt like as we were leaving our Texas room that there were some people kind of advocating that I speak up.
Yes.
Woohoo, you go, Michelle.
So I will do that, even though we didn't really finish whether or not everyone was okay with that. I work with our Medicaid and CHIP services department here in Texas, and when it comes to aha moments, I mean, I think in a lot of ways it's part of our day-to-day work, because from a sort of the bureaucratic policymaker perspective, we do our best, I think, to involve stakeholders and family members in the work that we do, but many, many times we don't, maybe because it's not possible because of the timing or the legislative pressure or deadlines, federal requirements, things like that. And it doesn't get past me that sometimes we make decisions that do not work for families, and then we hear about that later. And definitely in those moments, we think we've done the best we could do for a process or a policy, only come to find out that, in the real world, in the real life of people, it doesn't work. And so I think it's just part of the work that we do that we have those kind of aha moments, sort of just the nature of how things operate at the current time.
Yeah, I think that's great, Michelle, to point that out, that there's ahas all day, every day to many of us. And, the challenge, I think, back to that image of the story of the healthcare system, the simple but wrong is to just kind of ignore them. And sometimes we're forced, as you're saying, like funneled, siloed from time, money, other constraints that push us to that simple, but maybe wrong.
Uh-oh.
Did we lose her?
It looks like we may have lost Kara. Let me double check our participant list.
I don't see her.
I don't see her either. Okay. Well, why don't we carry on until Kara gets a chance to rejoin us. I think that she was making some great points, summarizing the first aha, and kudos to Michelle for being brave enough to go first. I wouldn't presume to pick up on Kara's thoughts. She's much more experienced in this area than I am. So with your patience and your indulgence, Michelle, why don't we go ahead and move on and see if there might be somebody else who
of course
is willing to jump on in there.
Just a reminder, everyone is muted right now, so if you'd like to join, you just have to unmute. *6 or on your computer.
This is Debbie Harris from Minnesota.
Hi, Debbie.
Hi.
Aha, my computer.
Oh.
Can you guys hear me now?
Okay,
Sorry.
I'll wait for Kara. That's okay.
No, I'm back now, I think. I am so sorry.
No worries, no worries. We did a little bit of wrap up with regard to Michelle's aha moment. And now we have Debbie Harris from Texas, who's going to, excuse me, not from Texas.
Minnesota. Yeah.
From Minnesota. Minnesota. Don't mess with Texas. Don't mess with Minnesota. She was just about to share her aha moment.
Awesome. Go, Debbie. I'm sorry.
Is it okay? Is it okay? Yeah. All right. Okay. I'll just try to make it brief. This is kind of based on the cartoon that Kara had put up during her presentation. of the group of people that were kind of lined up and being directed to go toward the simple but wrong answers, and then in the line for the people that were, or the way for the complex but right answer, and there was nobody going that way. And I was talking to our breakout team about my journey at becoming a parent advocate or family advocate, and how I found out how worthwhile it was. And that was my aha moment. And I talked about how when our son was born, we were still in the NICU, and he had a grade 4 brain hemorrhage. And so he was, you know, potentially going to have some very, very serious diagnoses and disabilities. And you know how you go through that entire roller coaster where, you know, one day they're very sick and the next day they're more stable and then really sick again, and you grab onto whatever positive word or moment or whatever you can get. And so it was one of those periods where he was stable for a short period of time, and your whole goal is just to have him stable and hear somebody say something about discharge, and you just want to go home and start to normalize what your new life is going to be. And at that point, there was a resident who approached us, and, you know, this was our first time, you know, even dealing with any of the type of diagnoses that Josh was potentially going to experience. And so we didn't know all the comorbidities and so forth that were going to come down the line. But when you're facing those, you don't want to hear about it all at one time, because you can't even imagine what it's going to be like. And you need to be able to take time to digest all of that, and you need the years of experience to get from one thing to the next. Well, she decided it was a really good time to just list them all, you know, like everything we'd face for the next 20 years, if we should make it that far, she said, right in that moment of that we found to be, you know, our positive, stable moment. So she just started listing off all the horrible things that were going to happen. And she prefaced it by saying, did you think that you know, you were just going to take him home and he was going to be fixed? And she said, these are the things that are going to happen to you. And it was so traumatic for me that I just remember breaking down, and they had to call my parents to the hospital. And it was so traumatic, I can still feel it today. Mm-hmm. And so our outlook just changed, you know, and it was something you just had to pick yourself up again and start from scratch. And all the hope that we had before, that it took a long time, you know, to build up from everything we'd experienced with him to that point, it was gone. We had to start over again. And so, but we did, because that's what we do, right? And so years later, I was on a parent panel, and it was like it was for residents. And so during their lunchtime, they would come and listen to families talk about their journeys with their children with complex needs. And so I was one of the speakers, and I was talking about our journey with Josh up to that point. And apparently this resident was in the group and listened to our story. And we had one of the more complicated cases at the time, and nobody had much hope for us. But our story to that point was a successful one, because we'd made something that appeared to be hopeless into something that was doable. I mean, it was working. And so at the end, before the end of the session, she called me away from the parent panel table and asked me to come outside, and she gave me a hug, and she apologized to me for what she had done years before that, and said that she was wrong and that she could not, you know, give the simple answer, and there were other approaches. And it made me to realize that, you know, just to keep going, that my advocacy for him at that time, when I didn't, you know what the journey was going to be, but I knew to keep going was worthwhile, and that it would not only have effect for other parents, but for residents and physicians as well. So that was my aha moment, and I think that gave me strength to keep going, and that's what got us, you know, here so far. So that was our moment.
That sounds like one moment and many, many moments, and some that continue to strengthen you as an advocate now and how you work with professionals too, I think, Debbie, and on this CoIIN. Thanks for sharing. That's really wonderful. How about, I think it sounds like somebody from Alabama wants to share, if everybody's open to more AHA sharing. Bethlyn, I don't know if you know who it is or whoever would like to step forward from Alabama.
Okay, I thought we were short on time, but do we have a chance? Do we have a parent perspective?
Yeah, I think that's great. I mean, we are short on time, but I have an idea for the questions to offer, and I think while the AHA moments are flowing, we should let them flow. That's great.
Okay. If it's on, just somewhere. Okay.
Okay, hi. As I said, I'm a parent, and my aha moment came several years ago. I'm a parent. I had 2 children with significant special needs, and we attended a conference one time where there was a presentation where they had one person sit in the room in a chair, and everybody in the room was given a balloon and a strip of paper. So each person had to go up to this individual that was sitting in the chair, hand them a balloon, and read the words that were on the paper. So the words on the paper would be something like trach changes or medical supplies or cleaning the house. So after everybody in the room had gone and given this person a balloon, you couldn't see this person anymore. That was my aha moment, because that was me. I was that person. I was like, oh my goodness, this is exactly how I felt. And it was like, then I realized that I needed to reach out to get some help, to reach out to professionals to help me with my family dynamics. So that's my aha moment.
That is a spectacular image and aha moment. And I must say that was you, and I'm, proud of you and thankful that you reached out, but also I think it highlights sort of the sometimes superhuman capabilities and abilities of families, and that, that's one of the powers here that we have on the CoIIN of, there is, as I said, this long history of engaging families and families bringing about systems change. But just as you said you're a parent from Alabama, but you didn't share your name. What was your name? But you from Alabama, sorry. What's your name? I don't want to call you parent from Alabama, but that you're highlighting that what you can bring together to the table, as part of the Alabama team and part of the CoIIN, and that lived experience of how to handle all of those balloons covering that person and how to reach out and how to work together and how to make it all happen. So thank you. That's a wonderful share. So we are out of time, and Meg and Bethlyn need to move to their next steps, but I would just like to say that, again, thank you guys for doing the SurveyMonkey survey. And I think that giving results and prioritizing the questions, what was clear was the sort of prioritization of the questions about, specific things about engaging family partners, but where there was more variety was the preparation of family partners and preparations of professional partners to engage with families. So we're going to come to you guys, I think, with some written responses to these questions. And then also Meg and Bethlyn can talk about how I alluded to earlier, maybe tailoring, especially the variation in the prep of family partners and professional partners. That sort of speaks to us of, we really need to tailor maybe some coaching, some TA, some training of serving on groups for families, of leading by convening for professionals, and just bringing about different family engagement changes. So with that, Meg, I apologize. We didn't get to the operationalizing and answering questions, but I promise it will be coming. And so however you guys want it from me, you can always follow up with me with questions or through Meg and Bethlyn, but there I hand it back to them. Thank you guys so much. And I apologize again for my computer cutting me off.
No worries, Kara. If it's not me having a technological disaster, then I feel like someone will, because it's just, that's the way it goes. So I think this one has actually run pretty smoothly, having only just one technical problem. I'm going to go ahead and switch slides now and turn it over to Bethlyn for our wrap up and next steps. But before that, I just want to point out to you all that if you go I mentioned earlier that we are going to have a shared workspace for you all with a portal through the newly launched website. But in the interim, we're using Google Drive as a sort of repository for some of our larger resources that don't easily get through either state agency or institutional firewalls as attachments to email. So if you go to this link, you will go to a folder on Google Drive, and it contains all of these resources on family engagement. And I do want to just call out one additional late-breaking resource that was added just yesterday to the folder, and that's a checklist that was developed by Tammy Bakewell in Oregon, and she uses it with her folks, and it has proved to be quite successful. And so we've given you some material here with content and education and sort of background, academic background and data, and then we've given you some tools and some checklists, so a little bit of a combination of different kinds of materials here. I encourage you all to check that out when you have the time. Bethlyn, did you want to take up next steps from here, or shall I continue?
I think that you're welcome to continue, and I think we could, if you want to go through quickly, and then we can just let people know, we can touch on this in the follow-up email, so they aren't going to miss a lot by us needing to end soon.
Okay, that sounds perfect. So we encourage you all to continue this work. We have a lot to learn from this CoIIN. Mary Webster just made a comment in the chat box to that effect. We are really, really going to be able to learn something through this CoIIN, not only about healthcare delivery innovations and alternative payment methods and some of those other sort of tangible, practical things that we're concentrating on. We're going to be able to learn through this CoIIN some really helpful and important lessons around family engagement. And we're really hoping to make a contribution, not only to our own individual projects, but other CoIINs and other quality improvement projects throughout the country into the future. So please continue this work. We have your coaching calls for guidance and support and technical assistance. You can always reach out to Bethlyn and/or I for TA on family engagement. We'll get you connected with folks who can be helpful to you, and we will continue to offer you opportunities for state cross-sharing and peer mentoring and support. Upcoming dates of notice. On the website, we'll have these slides in a PDF for you to reference back to. We will also have a recording of this webinar. And in the email, when we tell you that the recording and the PDF is up on the website, we'll also send all these dates as a reminder, so you don't have to scribble them down now. But we just wanted to point out your next team update form is due Friday, July 27th, and then we will be on a regular schedule of the last Friday of every month. We have another webinar, number 4, coming up in September, and we are currently processing state technical assistance requests to determine the topic for that. We have our in-person state team meeting coming up in October. We did have a quick poll for you now. Bethlyn, I'm no longer the host. I wonder if you're able to pull up that poll.
I think I can. Okay, I'm going to launch.
Yes, go ahead and launch. So our question for you today is, our state team in-person meeting is scheduled for Monday and Tuesday. If we were to start on Sunday evening with a dinner and some work together in that evening from 5 to 7, would that be possible for you all? Is that something that you could potentially do? So if you could just respond to that poll quickly now. We're going to leave it open for just a few seconds because we're already a little over time.
Mm-hmm. All right, I'm going to...
You're going to close it up now?
Yep, looks like we're good.
Fantastic. Thank you all so much. We really appreciate that. And then our next state team webinar is scheduled for November. I'm going to go ahead and move on. We had just a couple of things that we wanted to share with you. The Lucille Packard Foundation is hosting a webinar on care coordination for children with medical complexity coming out. Again, the date and all the registration information will be in the email that we send you. We've also mentioned to you MCHB has a care coordination for children with special healthcare needs challenge going on right now. I've already had a couple of questions about that. We will respond to them. we're excited about that potential opportunity for you all. One last request, please, if you could, go ahead and hop on this link and give us some feedback on today's webinar, how we can improve for the future, what you liked about today's webinar, and any advice that you would give us moving forward in terms of our upcoming webinar series. So once you get a chance to go ahead and go onto that link and fill out your evaluation, you are free to return to your regularly scheduled programming, and we will look forward to being in touch with you by email with more information about the recording and the PDF being posted on the website with all of the dates and other links that we've mentioned in this very brief close.
I think that I'm going to put it in the text box. I don't know if people can click on it from, yeah, someone just said that. Thank you, Jenny. You read my mind.
Great idea, Jenny. Thank you.
There we go. Thanks, everybody. If you can think about, too, just from your perspective, what you think might be helpful next in relation to thinking about family engagement and support for your team. There may be things you don't even realize, like there's so many resources available. We were talking about this before, and we even want to just do like an environmental scan of resources that we might know about to be able to offer to you as far as to kickstart so you don't have to reinvent the wheel. That's one of the things that we want to be here for. So I just want to mention that.
Thanks, Bethlyn. And thanks again to Kara and Clarissa and Bethlyn for their work on today's webinar. We very much appreciate it. As always, we wish we had more time to spend with you and sharing with one another. But I think the aha moments that folks were able to share today, the few that we were able to get to, were really meaningful and important. So thank you again.
And no doubt in breakout rooms, too, there were some good things being shared. So we appreciate everyone taking the time to do that.
So we'll go ahead and leave the chat box open for a little while longer so that people can get to that link. But once you filled out the evaluation survey, this is going to be the close of the webinar. Thank you all very much again. Appreciate it.
Thank you.
Thank you.
Ann, are you still there? Ann may be gone home.